Excuse me.
Orders on.
Perfect.
Are you going to begin with roll call?
Can we dispense with that for the actual workshop to get right down to the nuts and bolts
Okay.
of why you guys were here?
Okay. sounds good.
That said, I apologize for the delay getting our fourth for a quorum here tonight to at least actually be able to have this official workshop. So that said, you folks have the floor, by all means.
Good evening. My name is Scott Smith. I'm one of the members of the Board of Directors, also the training officer and quality assurance officer for Lisbon Emergency. Just going to point out a couple of folks to you. Chief McDonald, Deputy Chief Everson, John Courts is one of our captains, and then we have Amy McDonald and George, your last name is escaping me, George? Roll as board members in the back. We appreciate the town taking time to meet with us. We want to start a dialogue about what the future of emergency medical services for the town of Lisbon is going to look like, because we know we have to change. And we're going to talk a little bit about what we have to change on our end of things and how that may impact the town and the citizens that we serve. So we're a 501(c) emergency ambulance service, so we're non-for-profit. We provide emergent and non-emergent medical transport in Lisbon and Bowdoin. We have mutual aid agreements with Lewiston, Topsom, Durham, Auburn, and United Ambulance, which means we provide both accept mutual aid from them and provide mutual aid to them. We're licensed at the EMT level and permitted to what's called the paramedic level, and I'm going to explain that in just a second because it makes as you folks, if you're not overly familiar with the license levels and what people can do, that's going to be a big thing that we need to talk about in terms of getting the best service for the citizens of Lisbon. So EMR, or emergency medical responders, are trained in about 56 hours of advanced first aid. The problem is they can't operate on an ambulance. So we don't currently have any EMRs at Lisbon Emergency. Everybody is a basic level EMT or higher, with the exception of one person is a lifetime member who's a driver. EMTs are about 128 hours or a college semester of training. They can transport. They're using advanced first aid, medical and trauma management, AED, oxygen, and some select other skills. Advanced EMTs or AMTs is what we used to refer to as EMT intermediates. They have an additional 150 hours of training beyond the EMT level. They have some basic advanced life support skills, such as basic cardiac monitoring, some limited blind insertion, advanced airways, IV therapy, and some medication administration. And then paramedic is our highest level of pre-hospital care. It takes about 1,200 hours of training. Typically is accomplished at the community college level or in conjunction with the community college, and ranges anywhere from 2 to 4 semesters depending on the program. Those has a full range of ALS and BLS care, including medication administration, cardiac monitoring, 12-lead EKG interpretation, advanced airways, surgical procedures, etc. Service delivery. Operating from our base at 42 Village Street, we provide 24/7 coverage. We provide additional non-emergent services on a case-by-case basis with additional staffing. Currently, we staff one ambulance 24/7 with an ALS provider who could be an AEMT or a paramedic, and a BLS provider who's an EMT. That's the minimum to go out the door. Luckily, we have a number of folks who live in the community, are able to provide second call coverage or backup coverage for the primary crew should they need more help or resources. Again, the second ambulance is staffed as needed for special events like Moxie or for second calls. Well, don't we have volunteers? That's a yes and no question. And that's part of the reason that we came to meet with you guys tonight. Like all volunteer organizations, we're struggling to find people who can put an investment in time into initial training and then continuing education to stay licensed. Additional regulations from Maine EMS and other entities have pretty much eliminated volunteers at the ALS level. The volunteers that we have are very lucky, work in another primary EMS job for another agency and volunteer with us full-time. So to get, part-time rather, to get a paramedic, we're looking for someone who's a career EMS employee. They just may not be a career employee at Lisbon Emergency or another agency in town. And it's necessitated a shift to paid staff in many agencies, including ours. The other thing that has come up for us in the last few months, and I'll stack that in just a second, is that for a long time we stipended our volunteers. So in accordance for being on call, we had provided them a monetary stipend to cover, food when they were on station, gas and cleaning uniforms and that type of stuff. We got an opinion from our attorney several months ago that we could no longer stipend volunteers and pay people who, because we often have people who worked a day shift and said, well, I'll go home at 6 o'clock, stay in my house in town, and I'll volunteer for the night shift. And the attorney said that that's because of, they still had to meet the same requirements to be on duty as if they were actually on the clock. Our attorney's opinion was that we perhaps needed to compensate them, or did need to compensate them for the entire time that they were on call. So as you folks know, as business folks, our state minimum wage law has increased. We now have to compensate our employees at minimum wage level. So that has escalated the amount of our payroll cost astronomically in the fourth quarter of the last fiscal year and moving into this fiscal year. So barriers to recruiting people to come and work for us, and this will be the same with whatever option comes out of meetings with you guys and other people and players involved, is training. Training for the basic EMT costs around $1,000 for a cost of class, plus books and testing fees. Runs about $1,500. In addition, in order for those folks to do clinical, they have to have all their shots up to date, which costs another $400 to $500 if the provider can't provide documentation of shot records. Takes time, 128 hours, which is a college semester, and then it kind of spills into the months after that semester as they do their state licensure testing. In addition to be street ready, most services provide an additional 20 to 40 hours of operations type training, how to run the stretcher, area familiarization, hazardous materials, which is an OSHA requirement, Bureau of Labor Standards requirement, ambulance vehicle operator course, which is a state requirement that we have to put people through in the first 6 months that they're on the service, etc. Every 3 years, Maine EMS requires an additional amount of continuing education to stay licensed. EMRs are 32 hours, EMTs are 52 hours over 3 years, AMTs 56, and paramedics 72. Again, cost to go to those classes, cost away from home with family to take that class, availability of some of the classes is somewhat limited, and then there's the actual cost in on-duty time, the time away from home, family, or career responsibilities. The majority of our income currently comes from ambulance billing. We've been extremely fortunate to have received over $90,000 in grants in the last few years that have helped us replace a number of capital equipment items. But the true income level is relatively dynamic because it's not only based on call volume. So if I go up 50 calls this year and we bill a certain percentage of those, we would have more money at the end of the budget cycle. If we go down 50 calls, we theoretically have less revenue available to us at that. But there's complicated third-party reimbursement formulas. And we all know what comes out of Augusta in MaineCare and MaineCare is the Medicare equivalent, doesn't pay on a timely fashion. Center for Medicaid and Medicaid Services, we do bill Medicare. They provide a flat rated fee for ambulance services. So what we bill out is not what we take in. And for the last 4 years, we've not received financial support from the town of Lisbon or Bowdoin in some manner to help support the ambulance services from Lisbon Emergency. Just to give you an idea about our call volume, the gold bar is call volume, the blue bar is Lisbon calls, and I'll certainly, Twyla, make all this available to you.
Thank you.
For the council. We hover right about 1,000 to 1,100 calls a year total between mutual aid, the community, the two communities. Tends to be a little bit in flux. Sometimes it depends on just how things are going in a year. Sometimes it's more depending on other outside factors. But the problem is the cost of making even in the ambulance business is about 2,500 calls per year. Atlantic Partners EMS is one of the regional councils that's covers Bowdoin but doesn't cover this region. And Mr. Petrie's the executive director. Has a great deal of experience in systems level planning and is a Commission on Ambulance Accreditation reviewer. So he goes throughout the country reviewing ambulance services and maybe accredited, which is something that Lisbon is not, but some of the bigger services are because it has to do with preferred status with insurance companies. So we're essentially 1,000 calls plus short of where we need to be to support that level of billing. So to say that if we build out 2,500 calls a year, we could guarantee that we could probably put paramedical ambulance on 24/7 and feed the cost of providing that level of care. So we have some challenges. Currently, we have 5 EMTs, 6 AEMTs, and 10 paramedics. We have 1 full-time employee, the chief, who not only provides his administrative duties to take care of budgets and all those other things, but also spends 36 hours on the week covering the ambulance. And again, we're compensating currently as of April 15th, all of our personnel in accordance with the state Fair Wage and Hour Act. Just to give you an idea, how do we compare? It's hard to retain paramedics. This is paramedic salary. Where we are is down at the bottom. Second lowest paid service in the state of Maine. We compensate our medics at $13 an hour. When you see United up the street is compensating their entry-level employees at $18 an hour at the paramedic level. So it's hard for us to retain people to provide that level of care. Our goal is to provide the best level of care possible to the community 24/7. We'd like to have a paramedic available 24/7. Some days we can do that, some days we can't. The majority of our paramedic staff, as I said earlier, has a full-time career position with another agency and does this for a little extra cash. Okay, works with us. In the packet, we outline our corporate structure. We have a membership with voting members that's governed by a set of corporate bylaws. We have a board of directors and we have officers. Officers assist with the daily operation with the chief, consisting of the chief, deputy chief, first captain and second captain. Board of directors with a president, vice president, and treasurer. And then our membership, both of which have a vote in major decisions of the organization. Just to talk a little bit about what we bill versus what we actually take in, we define kind of, these are based on Center of Medicare and Medicaid Services definitions. Paramedic intercepts, we bill them the first 5, you get it at $100 a year or a call, Jim? A year. So we do that as kind of a mutual aid endeavor. That is unlike some of our neighbors that we have mutual aid agreements with that are now, recently we were told by the town of Topsom that they will bill us at $200 per call every time we call for a paramedic backup, that I don't have a paramedic available or I need a second truck with a paramedic. We're getting a bill for $200 from them, which certainly comes long before we see reimbursements from third-party payers. Our BLS rate is $660. That's based on standards from Medicare and Medicaid Services, what constitutes BLS. They divide advanced life support, typically provided by a paramedic or AEMT, into what's called ALS1 and ALS2. ALS2 is you're just doing more things. So if you were an unfortunate citizen who was very sick, having a heart attack, you required an IV, cardiac monitor, multiple medications to support your blood pressure because your heart attack was causing your heart to fail, perhaps an advanced airway, that would be an ALS2 bill. Generates a base rate of about $13.20 is what we bill out, and then $17.60 per loaded mile. Non-transporting scene calls, some insurance companies do
just have
question.
a question on the paramedic intercept. Why don't you charge by the intercept instead of 1 to 5?
It's
Be-
traditionally been that we have had a good relationship with our mutual aid partners, but the squeeze for our funding is affecting all agencies, as we, were recently informed by the Thompson, chief of that.
Right.
And that is something we're going to look at, in the foregoing budget.
And the reason I ask that, because if they have the same type of rates that they're charging the insurance companies, they're gonna be billing just say they're using your same ones. That, to have you on board with a paramedic, they're gonna be billing at $1,320, so they certainly can afford to pay
Yep.
$100 for each paramedic intercept.
And,
Well, in our last year, our contract with John, after that, we're going, like all the other services.
to change how our billing is done.
Okay.
And those rates, Diane, are what the standard Medicare rate is. So
Right.
that's gonna be the same Medicare rate in any community in the country.
Right, because if they didn't have you on board, they couldn't bill the $1,320. They would either have to bill the $990 or the $660.
Correct, depending on what
Right.
level of care
Yep.
they provided. Yep. So, and then non-transporting calls, for example, the $385 comes from, you're having an asthma attack, you know you have asthma, you ran out of your inhaler, we give you breathing treatment, you get better and say, I really don't need to go, I can call my doctor and get a refill on my medicine, and we sign you off, we can bill that at a higher rate than, because we provided against those skills. So cost and income. We're part of public safety, but we're also a healthcare entity. We know that anything associated with healthcare doesn't come cheap. Operational personnel costs are increasing yearly. The majority of our revenue comes from Maine Care and Medicare. We bill out about 53% to Maine Care and Medicare. The mix is self-pay, and I'll have a graphic on that in a second, and commercial insurance. However, if you go to another community that has a higher commercial insurance rate, you'll see differences in what their net revenue is. That's what we billed in fiscal year 2015, 2016. So that's 55% was Maine Care and Medicare. Insurance was 39%, and self-pay was 6%. 2 points that we did want to make clear were sent to collections in the past 6 years, $255,000 in change. We have a 6% rate of collection on that. Unlike other agencies or types of entities, we don't attach your house, your wages, your car, that. And since 2004, we have more than $790,000 outstanding in collections. Our job is to provide service to the public, and we haven't been aggressive about going out and saying, I need $5 a week.
Does the self-pay 6%, does that include your private pays and no pays?
That does include the private pays and no pays, yes.
And then the $790,000, that excludes your contractual allowance, right? That's everything that you would bill with that excluded. That,
I guess I'm not sure what you're saying by contractual allowance.
it's the amount you bill versus the contracted rate that they will pay, like the Medicare rate. I mean, or there might be private insurance companies will pay only a certain amount, but you cannot balance bill the patient, so it's
Correct.
called the contractual allowance.
Correct. You are correct.
So that's excluding that, right?
That 790 is the insurance collection.
Right.
The $10 deductible.
Do you know what your contractual allowance is each year?
I would defer to Jim or John for that. Contractual allowance,
When I read it, so-
Okay, thank you.
we can certainly make that available to you guys. Some changes and things that have impacted us negatively in the last couple of years. Plowing and sanding, we moved to a new base. We needed to move to a new base. We appreciate the support that we had from the property at 385 Lisbon Street. However, it was time to grow beyond that for many reasons. And it's about $3,500 a year that we have there. We did have a joint purchase agreement in the past with the town for reduced price fuel. We've not done that since 2014. That's another issue for us. Again, the paramedic intercepts cost is increasing. One of the big ones that's come up is, the hospitals no longer provide one-to-one medical supply exchange. So that's added at least $4,000 a year in expenses. And when we talk about medications, that's an additional $2,500 per year. It was an unbudgeted expense. We were informed in 30 days we will no longer supply you needles, catheters, that type of stuff. We have 2 aging vehicles. They are new. One is new to us. They're both relatively new to us, but both were purchased used. The 2009 unit, to replace that on the open market would be in the $200,000 plus category, and that's without anything in it. So the cost of doing business is expensive. And then we made the last 2 comments already. So when we talk about delivery model and what would be best for the citizens of Lisbon, there's basically 5 or 6 national delivery models. A purifier service-based model. Pros and cons can be talked about with that. Private for-profit, those are your for-profit ambulance services. Town department model, a not-for-profit model, which is what we currently operate under, and then a hospital-based model. Those are the ones that you kind of see in the Northeast and in the state of Maine. Other ones that you see nationally, there's a public utility model. That does not have a lot of traction in the Northeast. It does work in other parts of the country, but particularly where there's county government level administration with that. We included in the packet for you folks, we wanted to be transparent with you. Budgets and of past and our balance sheets. We know that if you get down to the meat of this, that's what we're bringing in for income this year, in this fiscal year projected, $343,640. Got a lot of expenses. When I condense them, $443,501 with our additional cost in equipment, supplies, vehicle concerns that have been more, and wages. So we have a net operating loss predicted for this fiscal year that we're currently in of $100,000 and change. That's a problem.
That's not good business.
It's not good business.
On that revenue that you get annually, that's the revenue that you collect in that year. There may be,
That's ambulance billing.
is that the billing amount?
That's ambulance, that's not total billed amount. That's what is budgeted to come back based on
Right.
the contractual allowance,
That's cash flow?
cash flow.
Okay.
So that's billing, we have to include donations in kind and grants, yeah. We have to list the grants as income because of some things with our not-for-profit status. What we wanted to come and talk to you folks about was, as you can see in the packet, a number of other communities subsidize ambulance services for a contractual basis. There are lots of ways to do this math, and lots of ways to come up with a formula. We put together some numbers because we thought we should come to you guys with some idea of what we think would work to help protect the citizens of Lisbon. A rate of $14.20 per capita, 2018-2019 fiscal year, so that's starting next July 1st. If the town was able to contribute $127,000 in change, that's $128,000. That would meet our ability to provide service in the current way it being.
Can I ask a question right there before you
Yes, sir.
move on? Reading the material in packet, page 11, is it actually $14.20 per person, or is it $14.20 plus $284 for the $100,000 for the replenishment of your capital fund?
Page 11, the $127,000 is starting fiscal year 2018-19. The $100,000 is what we project we're gonna lose in 2017-18. So starting in 18-19, the 127,884
to put back the capital.
Fund our capital.
Okay, so it's not 152, it's the 127, so that's what wasn't clear in that, the way that that was presented, that's all. I got it.
And then you can see as we go in additional years, based on cost of inflation, cost of doing business, that would go up, knowing that we have some additional challenges in the future. So the pros, support from the town of Lisbon to Lisbon Emergency, keeps an EMS unit ready to respond in Lisbon. We're not planning on going anywhere outside of 42 Village Street. The question would be, if an alternative delivery model is decided upon by you folks as the town council, what exactly are you going to get for whatever that model is? For example, is that going to guarantee putting a paramedic unit in town 24 hours a day? Is that going to guarantee that the truck is here and staffed, or is the truck going to respond from another location? Then we get into delays of care, response time, and those type of issues. Another big pro is we've got capital assets already. Should an alternative model be arranged, you're gonna have outlay for capital assets. Trucks run anywhere, you can find, used one if you can find it, around the $80,000 to $100,000 range. New trucks typically are somewhere in the 160 to 180, and that's with nothing in it. Okay, that's a truck sitting at the curb, not lettered, not painted, all that stuff. Maybe strengthening the partnership that you already have with us to provide services to the town. Cons, we realize this is a substantial financial outlay for the town, and it's a non-budget expense that we hadn't heard about until 2 minutes ago. So the contingency plan that we've come up with in-house is we're going to spend our capital improvement money. We'll balance the budget for the end of the fiscal year. Through cuts, other things, dialing back some things, and using our capital improvement budget. If we were to go to a per capita rate, as you asked, Mr. Wood, that 284 that's included in that per capita rate would replenish the capital improvement fund over the course of 3 years. So we could have work on the base for ultimately budgeting the capital improvement.
New ambulance,
The new ambulance, I couldn't remember if that was in there or not, the capital fund.
fixing the base.
There is a separate schematic in your packet.
Mind if I jump in for just a minute?
Sure.
Just because you brought it up, and I think it's a good point, too. So we just talked about the 2 trucks, and you talked about, obviously, if you choose a different path, the trucks. Didn't you mention that the trucks that you have, it sounds like you're setting up to go ahead and purchase, that's not a small ask.
It's not a
And you know, it's not 1, but 2 that you need to get.
So we are pretty confident, based upon what our mechanics tell us and things, that the 2009 unit will reach the end of its service life in 2026, 2025. Will be replaced in 2026. The other unit is a 2001. Expected service life is supposed to be 20 years, but we have started to run into some mechanical challenges with that vehicle.
Mhm.
If you want my personal opinion, I do not think that will reach to the end of the budgeted service life.
Okay.
So it's going to be replaced sooner rather than later.
And traditionally, what I want to see if I can remember this, was it 80 to 100,000 for?
80 to 100,000 for a used truck if you can find one, but with the 2009 to find one that met what we needed for requirements, looked good to the mechanic and everything, took us 2 years to find that truck.
What's the new truck look like?
160 to 180.
Okay, I just wanted a comparison.
Yep.
Thank you.
No problem.
So, looking at replacing at least 1 ambulance within a 3-year time frame that you're also trying to replenish your funds is what you're looking at for reality?
For reality.
And you're tapping your capital improvement to balance the budget right now.
Okay. Yes, sir. By all means, come on up.
Yep, if you look in the capital improvement, we planned for replacing the 402 ambulance, the one we're having troubles with in 2020. It is budgeted in there. We went worst case scenario. And and we're planning on putting at least $75,000 down on that out of our capital improvement plan, and financing the rest of that. The other thing that's kind of not showing in this, we try to go 10 years out, is in 2025, by replacing the other ambulance, that 1 year is gonna be a bad year. We're gonna have a lot of bills, but come 2026, we will have our 42 Village Street paid off, and we'll have the other loan on this, the loan will come due on the current 401, the one we've replaced in 2025. So expenses on the capital improvement plan will actually go down in 2026. But the replacement plan for the one that we're having the issue with isn't here. Repairs on that truck this past fiscal year were $13,000.
Not including tires, they're $800 a set,
Yes.
$9,000 a set.
That we just did in this fiscal year, correct? We had to replace 4 tires on that ambulance.
And you get 2 years out of them, or not even, right?
Yeah, not even usually.
Not even. Thank you, sir. Yeah, I remember seeing it. Thank you for pointing it out, Chief.
One more, to kind of go back to the slide. Using the 80% model for Lisbon subsidized, I'm assuming the other 20% is going to come from the other, Bowden, the other community, if they choose to.
Participate.
Yeah. And if they don't, then what happens?
So total calls will go down.
Mm-hmm.
With total calls goes down some of the fixed costs of operations. But we would need to reconfigure the budget to assess for that. You know, I think a reasonable, there would have to be some hard choices made in terms of, do we stay at the 2 truck level, which is very important to us. We fail for having that second call availability for a unit.
Right.
It's traditionally been very important to us as an organization. Or do we drop down to 1 vehicle in some sort of a quick response vehicle?
That's what I wanted to understand, and thank you for clearing that up, because what I wanted to understand there was mutual aid, and we only can use the model that you mentioned earlier from Topsom, is going up.
Yep.
So you have to get to a point, if you're not gonna have a partner, it's just gonna be Lisbon, then you have to say to yourself, is it cheaper for us to pay for the mutual aid from elsewhere or continue to maintain 2 trucks? That's just what I wanted to hear.
So it would be something that would need to be looked at.
Thank you.
I think we kind of dove into capital replacement plan a little bit. I don't do well with charts, and I know that's hard to read, but it's the best I could put it together in the PowerPoint for you guys.
That's okay. You're sending it to us so we can digest it at our leisure.
So to succeed, what we're coming and asking the council for is in the next few months to make some tough choices, to work with us. And ultimately, we would like to stay a viable part of the community in providing service to it. But we're gonna need to have a financial commitment, because we obviously, as a 503C corporation, still have debt. And I can't liquidate all of my assets and still have the debt load of a substantial amount. If we cannot come to an agreement, what we would say is that if our cash reserves fall below $35,000, and we don't have an agreement from the towns of Lisbon and Bowden to help support us in the next fiscal year, that's fiscal year 18-19, we would drop down to daytime coverage only, 6 a.m. to 6 p.m., and we would have to work with the town to find a mutual aid partner that would cover the alternative 12 hours a day. If we fall below $15,000, we will cease operations on a 30-day notice as outlined in Maine EMS rules and law.
Net coverage is, if we revert to your first bullet point, that's payable by Lisbon EMS, and ultimately it's going to end up with the taxpayer in one form or another.
I don't know if I know how to answer that question.
Take your best shot at it.
So yes,
Obviously, the trade-off there is you can actually reduce your hours. That
Right.
is going to be coming from another need being filled by somebody else. Who picks up that cost, I guess is my question.
and that would have to be something that we all worked on. We're not gonna walk out of this room tonight and say, well, we told you that we need $100,000,
Right.
and if you don't give it to us, we're just gonna close the doors and auction base off. We wanna work with the town to provide service. We think we have a good model, we have good people that work for us, but you're right, the cost would have to be borne by somebody, for that additional staffing. That 12-hour hold.
Right. That was where I was coming from, because it just seems like it's opening that slippery slope to the number two just happens quicker, because if it's something you guys can't absorb, so you're actually contracting what you're actually doing for a time, you can't have costs covered from somebody else at a higher rate if you
Right.
couldn't do it in-house.
Right. You know, in the alternative delivery models, there are certainly lots of ones to be looked at, you know, those 5 that we talked about a few minutes
Right.
ago. All of them are gonna cost some outlay to somebody.
Right.
Um, If we can reach a per capita agreement with Town of Lisbon and Bowden, we would continue service at the present level, spending that, knowing that we're spending our cash reserves, and then we would pick up funding from Lisbon and Bowden in the 2018-2019 fiscal year. And I'll put to the bullet point in red, we feel we've got a commitment to the town. We've been here in operation since 1976. This service was founded because of delays in response from a unit coming from Lewiston and the death of a high school student. We want the service to be available to the citizens in the quickest manner possible. But if we can't get an inkling of which direction we need to go in with the help of the towns of Lisbon and Bowden, we're gonna have some hard choices, and we'll probably cease operations on December 31st. Because we can't spend down.
The model's not sustainable without some sort of change.
Right.
Have you had this same conversation with Bowden yet, or are we the first,
You guys are the first, we're set to talk to them on the 31st of the month.
based on their schedule as well? Right.
Okay.
I'll entertain-
With the kind of, I guess the question I have to Diane is, with what they're looking at for an ask in the coming year, is that something we would have to put it out to bid, or is that something we can go to this through a specific with our purchasing policy?
According to the purchasing policy, because it's a service.
Because we have the flexibility within, that's what I,
Right, so you'd have to put it out to bid. I'd have to look at the charter that sees if it gives you any,
latitude
Latitude,
for,
but
based on what we're
I'm
looking
guessing,
for.
no, I'm guessing you would have to. And then if, once it gets up, well, we know, because of the charter, anything over 250.
Yep.
Which it could in a few years, then it has to go to referendum, so.
Just to put a couple more thoughts out for you folks, and then so you know a lot of information to ruminate on. I'm fairly active in the EMS community statewide. This is not an unknown entity to other communities, particularly the size of Lisbon. There's a lot of people out there that services are in the same boat, whether they're fire department based, whether they're a separate third service or not. They're all being squeezed for volunteers, they're all being squeezed for revenue, they're all being squeezed for increased training mandates and increased service delivery costs. And I think that, you know, we're coming to you folks as soon as we could configure a plan and have something useful to present. There are other folks who may not be that lucky in other communities. Their service will just evaporate. For lack of volunteers, lack of money, lack of funding.
Hey, question for you. Talking about that $790,000 of outstanding that's owed, I'm sure you guys, I realize you guys are probably are very few who wear many hats, and I thank you for that. That's the first thing. But the second thing is, of your counterparts, since you're actively involved, which communities are having the most success right now collecting?
The majority of the communities that to list off specifically are ones that go to a more aggressive billing schedule. We do
what I'm driving at here, and thank you for sharing that. So 6% return on average. So let's just, the best possible case scenario, and I'm just spitballing, I'm not saying this is accurate, but let's just say the best turnaround would be 12%, double that.
Yep.
That still would only get back a drop in the bucket of what would be.
Still
Yeah.
gonna get back.
And grants for equipment, I heard you guys talk about the grants for equipment, I'm sure you're very aggressive on getting that grants money, but even then, it's a very small pond to draw from, I'm assuming?
It's a small pond. We've been extremely fortunate that Firehouse supported us for $30,000.
Nice.
That Stephen King Foundation supported us for 18,000, 17. That the Davis Foundation supported us for an additional 30,000.
So you guys
Those
are,
are major grants, and Amy is our grant writer and has done a great job
thank you, Amy.
with that. But yes, it is a small pool. One of the things that, if the delivery model changes, grants are very specific. The type of grants that we're, as you may be aware, that we're going after is because of that 501(c) status. And that's where we've been funded because people look at the nonprofit status and
Yep.
that. In an alternate delivery model, that would be something that may or may not apply in the future.
That's exactly it. It's a shifting of, like, and that's what I hear what you're saying. If we were to look at that and entertain that idea, then it changes. And so the grant monies that you've been fortunate enough to know how to every year finesse that and get those to you, you maybe have a sort of a transition year or two to figure out where do we send for our grants now. So, okay. Thank you. I wanted to understand how you guys, go after those grants and how aggressively, and now I do. I get a better understanding. Thank you.
Any other questions?
How about you, sir? You've seen this a lot.
Yeah, I need some time to digest it and come back to you guys with an opinion in a bit.
Well, I appreciate you guys coming in, by all means. The thing that, key takeaway is that this will be ahead of this year's budget discussion for sure, because you need an answer from us. Because you need a commitment to know if you're gonna actually start tapping in resources this year from your reserve account. Action plan to move this forward. Any suggestions on direction from you?
If they're gonna meet with Bowden at the end of the month, I say we bring this thing first, our first meeting in August, if that's not too fast for you folks. And
And possibly even something between us and Bowden to actually figure out what they're thinking so we can share resources.
I think if they get a favor, I think my thoughts is they go there, they give this presentation, if they get at least some interest versus a flat, we're not participating, then I like the idea of us partnering with Bowden and sitting down in a workshop to talk things out and figure out where we land.
Back to the Bowden chief, and he says, knowing his town council, they're gonna put it out to bid.
Okay, well, then.
Yeah, I think that's the same reality that we're looking at with our current policies. We have to. It's just,
And, we certainly, in Lisbon Emergency, would submit a bid, but it would be a bid that would be reflective of true operational costs.
right. We know what we're getting here, so would have to craft the RFP that it would be an apples to apples kind of comparison, not actually having somebody slide in for less services to slant the bid.
I think, yeah, you nailed it. It'd have to be the existing services that we have and no degradation of that.
Right, or if it is, that it's to the point of one of your last slides, is if you're gonna take a lesser level of service for a reduced cost, we know that going in to start. So that isn't actually something that has to be picked up by somebody else without knowing to begin with. That's the reality of what you guys are looking at right now, is the fact is it's that if we go into that first bullet point, we're already looking at a cost, who's gonna pick that piece up and not knowing the answer to that question. Is there anything in what you guys presented that you're not getting that we don't understand? Let's put it that way. I know it's kind of, it's very bleak. I know it's probably the last place you want to be standing tonight, so I
Can
do
I say
present.
something? I'm just not sure that going out to bid will apply in this circumstance, because no other service around us has a base right here in Lisbon. So we're not like Bowden. They can go out to bid because they don't have anybody based. in that
That's
town.
how they found us.
Right, so, to do a comparison, apples to apples, I don't know how you would do that in a bid, because they're unique. They have their base right here in Lisbon. Nobody else is going to.
So
So
am I hearing you that it's best to work within the existing structure and
I-
find a way to
I
make it work with our,
I would, because your service level is not gonna be the same. If you go out to bid and you get, say, United that comes in, unless United is gonna put their ambulances right here in this town, you're gonna get a different level of service. That's
Which
just
is-
the way it is.
which is not what it was in the 70s, which started to get to this point where we are today.
Right, and if we didn't have the base here in Lisbon, then I would say, yeah, go out to bid, because it would, you could get the
I
true
might be-
comparison, but.
I might be jumping here and just stop me if I'm misinterpreting, but sounds to me like you're saying that the only thing that we could really entertain is making.
It's better to
Lisbon
work with our
Emergency as
business
a-
partner.
Or looking to add them as a department unto themselves, under the town's umbrella.
Yeah, well, I wouldn't go that far.
I might be jumping there.
Wouldn't go
Ah,
that far.
I said business partner for a reason, sir.
I know where you were going with
Yeah.
that.
I think if we're talking 200,000, we need to make sure we've investigated all of our options before we
Right.
agree to something. That's a substantial amount of money.
Goes across the country, the Lisbon Emergency Emergency, they need to buy them. And Ricky Drayton from EMS, the only one run away this region, are willing to come in, billing company, need any information, so they will come in.
So maybe some other additional resources from when we sit down. Yeah.
Come in and
Okay.
Yeah.
Okay.
and Diane can just let me know, like, come in, back to you guys.
We can't give you any
Hang on to these.
definitive action in a workshop, but clearly you've given us enough that it has to be something that'll be on a council agenda to get you something sooner than later. Thank you.
Thank you for your time. I assume this power strip.
Anybody else before we close the workshop?
Oh, okay, good.
Seeing none, let's close the workshop. Thank you.
5 minutes, stretch your legs.
Yep.
Yeah, sounds good.
Sorry, sir.
How are you?
Yeah? Where are you on the agenda? Appointments.
Chief, what do you need? We're gonna have. Shoot, fire, 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 fire. Wanna catch him?
Not necessarily questions, but just like.
Yep. Yep.